Tanse, hello, my name is Shanell Twan. I am a carrier from the Interior Cariboo region of British Columbia. I'm joining you today from Treaty 6 territory here in Edmonton. I am the board member for the province of Alberta for the Canadian Association of People Who Use Drugs, and I'm currently a co-facilitator for the local chapter of AWARE, which is Alberta Addicts Who Educate and Advocate Responsibly. So today we were asked, if we were living in northern communities, in Northwest Territories and First Nation communities or Métis settlements, and had family or friends living here in Edmonton, what would we say to our family and friends here in Edmonton to encourage them to get the vaccine? I would strongly encourage everyone, whether you be Indigenous or not, to get the vaccine, but especially for us in Indigenous communities. Back at home, we have a lot of elders and traditional knowledge keepers. I would strongly suggest to keep our communities as safe and healthy as possible, that we all should get vaccinated.
I'm Sandy Ferguson. I'm the minister at Strathern United Church in Edmonton. What is the role of religious leaders in overcoming barriers to COVID-19 vaccines? I see my role as someone who clarifies the situation in terms of what does, in our tradition in the church, what does the Bible say about vaccines, correct misinformation that is often used, and in a more positive light, explain the benefits of vaccination, that as a matter of faith, in the Christian tradition, we live as a community. And through vaccinations, we are able to live as a community and support one another. And Jesus calls us to care for one another. And the message I have been stressing over the last year and a half is, by vaccination, we show how willing we are to care for one another. And that's what I see as the role as a faith leader, is to be a positive message of the importance of vaccination as part of our community of faith.
My name is Fernie Marty, elder for Papas Chess. I'm here in the city, I live here in the city of Edmonton, Alberta. Some of the fears and worries of the peoples is, misinformation about the COVID. We're told that they're microchipping us. Different theories, different propaganda, false propaganda about this disease. I believe our government failed us thoroughly in regards to the information, the proper information that should have been shared with us right from the beginning, instead of trying to hide the facts that this disease did exist and it was, here in Canada. Also the fact that, people need to be informed that they're not microchipping them. They're not there to microchip them. They're there to help them overcome this disease that is available to us. We're a social people that worries about, what about my relatives? What about my people? Well, we all have to do our part to get the needle in order to be a part of who we are in this community. I love my children, my grandchildren, my great-grandchildren. And I was worried too, and I decided after talking with elders, many elders, they said, it's a medicine, go and get it, go put tobacco first, ask for the Creator to help you with this medicine, you won't get sick. That's what I did. For both needles, and I'm grateful that I did. Now I see my children, my grandchildren have followed suit, and followed me in getting their vaccinations, and I'm so grateful that they did. And less worries, less concern about this disease. We know that it is rampant throughout the community. We understand now that 80% of the population in the hospitals as we speak are those who never got vaccinated. And I'm saying, well, it's because of the fears, miscommunications on not only the government's part, media should have been more thorough about the proper protocol for this disease, what it is, why it happens, how it affects us. That kind of information should have been out there and published to all of us. Thank you for listening to me.